Welcome to Pivotal People. Today we're talking to Eddie Coombes. Eddie is the founder and CEO of Optima Health Care. Thank you, Eddie, for joining us. It's really lovely of you to come over to London and join us. What I want to do first of all is talk about you and where did you start from?
First of all, thank you for inviting me along. It's a pleasure to be here today. We immigrated to England back in the mid-70s from Sri Lanka. So first, the 70s, 80s and early 90s, were pretty challenging times. My mum worked in the civil service. She got a job in the civil service in Paymaster General's office, and my father was a long-term psychiatric nurse in the NHS.
Oh, wow.
Yeah, so he basically ran some of the wards at Royal Earlswood, where he also trained, as well as then going to Farmfield, which I think now is Surrey Oaklands. So he was actually part of the original team that closed the hospitals down in the mid-80s and converted, moved all the patients as they were then into those early stages of supported living in the community.
Goodness, I remember that time.
Yeah.
It was quite a challenge, wasn't it? Because we'd been locking people up.
It's interesting to say about locking people up, but back then it was normal.
Yeah, it was.
And certainly for us as family, we were really integrated into the hospital life. So we'd go for the summer barbecues. I'd help out with the fireworks, and it was really a fun environment, and really integrated with the as they call them, patients at the time. So it was quite a unique position to be in, because I don't think you can have that today.
No, I think you're right. I know I have the same sort of background. My daughter, for example, came into the care homes I was managing, and is now a Band 7 nurse with the NHS.
Oh wow!
And I think because of that background of care, it does. You've obviously got your dad's passion of care, and I think we do pass it on to our children, don't we?
Yeah. Yeah, we do. I mean, it was quite a normalised environment, but also my mum was extremely entrepreneurial. So, I owe a lot for where I sit here today for her, because she was driven and ambitious, with a very caring heart. And my dad had the technical bits, really. She couldn't do all of that kind of stuff.
Perfect partnership.
Yeah, well... Yeah. Didn't feel like it at the time, but when you look back, it does look like that.
No, they're very true.
Yeah.
So what about, just tell me a little bit now about what you're doing now.
Okay, so Optima, we formed as a family. It was really instigated by my mum. Effectively, my father and my mother started care home business back in '87, and they ran a couple of care homes for many years until my father passed away in the late '90s. And at that point, my mum couldn't really cope running the business on her own, and it was becoming highly regulatory, with C-Sky and the evolution of regulation at that time. Yeah. So she sold up and stepped out for a few years, but passion was to go back in, and for me, I was in the technology sector, in the consulting business. So it's quite a shift going, but it wasn't abnormal, because obviously used to the environment.
And your technology background now, with the last few years of technology transformation in care homes, that must have been a real help to you with where we are now.
In part, I think I spent 16 odd years in consulting and then running large scale channel sales operations in Europe for a US software firm. I had previously worked in the US and in Europe as well, so I was really privileged to get some exposure, not just in the UK, but when you move from professional services delivery to customer, it's quite different.
It's very different.
And I wish I knew the challenges of the customers better when I was back then than as I do now as a customer.
Yeah.
So the journey's not easy. I think knowing the core fundamentals of technology, you can have a fairly informative discussion, with your suppliers or the professional partners that you're working with. But there is no real experience that goes in that you can draw on that goes into delivery culture.
No, I understand that. I think it's a massive change for somebody like me. I was a care home manager when we had a bit of paper, one sheet of paper with a care plan on it.
Yeah.
Then we developed, when I was with the big corporates, big files like this that had care plans in it, and now we've got computer programs that do it for us. And I think the future there is going to change. So with what you do, how do you use digital technology with your own service users?
We're fully digital across the board, and there's been quite a journey. We actually started a year or so before COVID kicked in, so we were lucky we had some fundamentals in place around being able to share data in the cloud and having communication via Microsoft Teams, and that was a godsend. The only thing we had to do is to set up new laptops and get them out to people. So, I was there, basically configuring lots of laptops and then driving them out to services because there was nobody else that could do it. No. So, it was a real roll your sleeves up moment. But I think getting through COVID was difficult, especially because we hadn't transformed our care planning system. And, I think I felt we chose a bad partner, not a bad partner, but a partner that didn't meet our expectation, and therefore we hadn't implemented sufficiently enough to deal with the governance during that process. So that was a learning experience, and we had a number of challenging issues a few years ago, which we've worked through, but it was a learning experience.
Yeah, it was a time of challenge for all of us, wasn't it? And I think working in our sector during COVID was completely life-changing, really, wasn't it? It was just completely different to anything we'd ever done before. I think the future of technology for me is I'm starting to learn a little bit about AI and how that can take an assessment and write a care plan. And the writing of care plans is the bit that we're constantly getting told by CQC that we're not making them person-centred enough. We're not. And if we could just get a client to write their own care plan somehow, that would solve all our problems. How would we do that?
Well,
how would we get somebody to actually physically write their own care plan?
That's a challenge because it's really down to the individual.
Absolutely.
So I don't think you can have a method where it applies to everyone. Yeah. Some people may be able to contribute some small part to their care plan and get some core essentials going, and how they can communicate into that, versus others who will be much more able and can potentially write a much larger piece. But ultimately, I think as care providers, it's our responsibility to ensure we find ways for the individual to input into that care plan, whether that's electronic, other forms of communication, or whatever, to ensure that we capture really what their needs are and how we can look after them in a comfortable way.
Yeah, and you're looking after quite complex needs as well, aren't you? You've got people with quite complex.
Yeah, so we got two areas of the business. So we got specialist business, which is Optima Care, and there we focus really on enduring mental health, intellectual disabilities, autism, and we really feature heavily on forensic history. So these are individuals that are in long stay hospital or prison services or some other form of detention environments, and helping getting them out into community in a safe way, but also to enable them to explore some forms of rehabilitation and engagement into day-to-day life.
That must be a real challenge in some cases.
It is, and we've had some pretty high-profile cases. I think we've really built up a very strong digital governance framework with active reporting environments, which has been really helpful. Yeah. And what that does is that really helps us to identify risk or manage risk much faster than if it's paper-based or if the systems are not integrated. But behind all of that has to sit a good team as well.
Absolutely.
And a team that's really bought into how you manage risk, but how you manage safety on the other end of that.
Yeah, challenging times through, especially if you're dealing with those people that could be a high risk to themselves and other people. And how do you deal with that if you've got somebody who is very, very high risk?
Yeah, well, I mean, I think risk comes in different ways. So, I mean, the second part of our business is we've got nursing dementia services, but we're at the more complex end of care, so very much nursing driven and professional input driven again. And what we're trying to do, or what we are doing, in fact, is we're taking the expertise of having run quite complex, challenging environments in the specialist side, with that multidisciplinary approach and the governance, and then bringing it into the care home setting. Yeah. And what that really means is it enables us to provide opportunities for people stuck in long-term acute beds, that need a high level of input and support. But there are not many operations out there that can support that type of service.
No. I think we've all been in situations as care home managers of elderly care homes where we need to move somebody to somewhere that would meet their needs, and there's just nothing we can do.
I think it's important to focus on why we do such complex care as Optima. The value for us and what drives us is about creating safe services that are homely for the most vulnerable people in society who can't normally access services outside a hospital, and that's really important to us. Yeah. And that has driven us down the path of doing more and more complex stuff, to the point that we do get now commissioners approaching us asking about very special cases, whether that's in hospital or in community. Yeah, it's a privileged position to be in, to be able to help people.
Now tell me about the future. For you personally, what's your future look like? How have you planned your future?
I think for us, the future really is about leadership and succession planning. Yeah. Having gone through quite challenging period, and I think times are still quite challenging for providers. And really one of the things I really care about as a leader is contributing, and what can I contribute? Less about achievement and more about contribution. I've done a number of years supporting Care England in a number of their working groups, and I'm executive director at National Care Association. So we tried to help around government policy, engagement with regional associations and trade bodies, as well as individual providers that need some level of support. It's important for us as leaders to continue to contribute, because we can all contribute in different ways. Yeah. There's no one expert, and one person doesn't do everything. It is a combination of everybody's efforts. Yeah. So I think longer term I'd like to do more of that, supported by a good succession plan. We've got a good team in place. Our MD that's joined us now 15-16 months ago. Yeah. Fiona Williams, she's doing a great job with her new team. So I can pick out lots of different people within my organisation, but I think the really satisfying feeling now, when you look back on the journey over the last, I don't know whether it's 3 years, 5 years, 10 years or 20 years, is seeing an organisation coming together. Yeah. And it takes time, because it's a bit of luck involved. Yeah. Having the right people at the right place. It's about having the right partners. One partner might do a great job for one company, but won't do for the other because there's not a culture fit or the engagement. So there's a lot of things that have to come into line to make things happen. So I think you've got to be grateful, when things do come together, and reflect on then how do you improve from there. So I think we'll continue to, we're on a growth journey. We're just about to launch a new brand called Kinley Care, which will focus on our care home element of the business. So to have more
Kinley Care.
Kinley Care.
Okay, and where are they based?
Well, at the moment we've got some homes in Suffolk, but we're looking to expand that either through acquisition and or provisioning new services. But I think that then that's going to be another step in the journey. It's going to be exciting. I think we're not quite sure how it's going to hold as far as the economic backdrop is quite uncertain at the moment.
Yeah, the cost of delivering that care is huge, isn't it?
It is, but I think what we're also seeing now, and I've had some conversations with some senior commissioning directors within local authorities and the ICBs And I think there is a realisation, look, that there isn't enough money in the system to support the demand. That's the reality of it. And the economic backdrop, we've had some major shocks in this country. I think we can't underestimate that. It's not just affected health and social care, it's affected the whole economy. But we are so reliant on people, cost of delivery, especially around insurances, cost of capital, energy. These are all large items that you're needing to manage, but we all have to find solutions. We know what the problems are, but how do we navigate the solutions? Is going to be the trick.
Yeah, absolutely, and it's how we can save the money and where we can ease that squeeze a little bit.
Yeah.
Thank you very much. It's been a really interesting, inspirational chat. Thank you.
Thank you very much for your time.
Good
Thank
to
you.
meet you.